Hey guys, it's Derek Z. This video is going to be about exercises to help with lateral elbow pain. So if you have pain on the outside of your elbow, this could be called lateral epicondylitis, or if you were told, this is also commonly known as tennis elbow. I have a few exercises for this condition, but keep in mind that there is a part of this condition where lateral elbow pain can actually come from the neck. So if you try some of these exercises out and it's not working out, then please go check in with your doctor just to make sure it's not coming from your neck. The first exercise has to do with wrist extension. So you're just resisting that motion. Wrist extension is this motion that activates the muscles that are on the forearm, which then actually originates from the source of pain, the common extensor tendons. A lot of these muscles here come over towards down into the forearm and actually into the fingers. So to train those muscles, you add resistance to that. So I have a 5-pound weight here. You're basically just sitting. These exercises are performed slow and controlled because then you're trying to affect the tendon. So you're basically letting this wrist go down and then you come up slow. And you can also just palpate yourself just to see, make sure these muscles are turning on, especially when you're turning the wrist up. And again, I usually have people do this about 10 times. If the weight is too heavy or this causes pain to a point where you can't do it, then the weight is too much. So if that is the case, the easiest version is to just do it without it. And if you can find some discomfort there while you're doing it, then that would be the intensity at which you can tolerate at that point in time. If this is easy and you don't really feel anything, then you grab a lighter weight, maybe like a 2-pound or 3-pound, just to start off with. So that's what you would do in terms of the first exercises for resisted wrist extension. So the second exercise is resisted supination to help engage the supinator. The supinator is a muscle that lives on the outside, or really on the back of the elbow, and it wraps over onto the front of the forearm. And when it engages, it pulls this direction, which then actually performs the motion of supination, which is where you just turn your forearm with your palm facing up. That's essentially supination. So when you do this, you just need a band, a resisted band like this. You just grab onto it. Start with the palm down, and then from here, you just turn that way. Another thing to take note is the bicep is also a supinator as well too. It assists in that motion, but we're targeting this for the reason of engaging the supinator. So again, you start with tension, band's already taut, and you're just turning it out to engage the supinator. So you know you're doing it right if you can palpate your bicep. And the biceps also engaging as well too, because that's also doing supination in addition to the supinator itself. When I have people do this, it's usually slow and controlled. About 10 reps is what you're shooting for. Obviously, not everybody has a rack at home. So usually what you do is if you have a band like this, really any band that has resistance, what you can do is you can take a band like this, tie a knot, and you can throw this on the other side of a door and then just close the door. And then so you can adjust where the height is, and you can do the same thing with resisted supination. Next exercise has to do with eccentric pronation. So the pronators live right over here, and they're responsible for engaging, and when they turn on, they do this to your forearm. So you can actually put your hand here and then turn it down, and you can feel these muscles tighten. So that's how you know you're working the pronators. So these are muscles on the opposite side of the source of your pain. If you have lateral elbow pain, you want to work on both sides to help stabilize the entire elbow complex, not just where the source of pain occurs. So to do this exercise, you grab a stick like this, and if you don't have one like this at home, most people at home just use a hammer. So if you have a hammer at home, and to make this exercise easier or harder, you basically just hold it closer to the heavier portion of the hammer. So this is the exercise here where you just turn, slow and control, your arm into what we call supination from before, but this is actually eccentric pronation because eccentric has to do with control
of certain motions. So you're actually using the pronator to control this motion. So if the pronator is not working, your arm would just fall down that way because of this weight. So to make this a little bit harder, you would hold it at the tip of the handle, because now the distance from where you're holding it and where the resistance is further. It's going to be a lot harder on your pronator. So you can use a hammer at home to do this. And again, when you're doing this, we're just shooting for about 10 or so. When you're doing these exercises, this one particularly shouldn't really hurt a ton. It may hurt a little bit because you're gripping the handle, which actually engages the extensors as well too. But again, you're doing this to your tolerance. Nothing too crazy. If you're doing this, I'm expecting there to be some discomfort, because when you're training tendon, when you're rehabbing them, you're supposed to engage them, and as a result of engaging them, if there is a source of pain there in that area, it's going to be discomfort. There's going to be a little bit of pain, but as long as it's tolerable, then we're doing okay. So the last exercise have to do with a band, having it inside your elbow crease. So this is actually a joint mobilization, or more so you're doing it yourself, so it's a self joint mobilization. Usually a lot of times when the patient's with me in the clinic, I do this for them with my hands, and then they just squeeze the ball on themselves. So I'll show you how to get this done. You basically need a band, a pretty heavy band like this, and then you can just tie a knot, put it on the other side of a door like I mentioned at first, so you can get it to be as tense as you can tolerate. So you need to take this band and put it just below your elbow crease. So for me, that's about right here. So you get tension by moving out, scooting out this way, making sure the tension of the band pulls the elbow exactly that way. So what you want to do is you're laying down when you're doing this. So that way you get a good amount of pressure just pulling out. So this is more like a lateral glide on the elbow. So when you're doing this, squeeze your fingers, make a fist. If there's pain, then what you want to do is grab the ball. This is just a squeeze ball. Bring this elbow in, so you're applying the lateral glide force onto the elbow, and then you squeeze the ball. And you do that for about 5 seconds. And then you do this for about 10 times. With each time, if you're doing this correctly, there should be less pain, because now you're opening up the joint in the elbow. Remember, this condition is coming from likely from a tendon, so that's usually what causes lateral elbow pain or tennis elbow. So if that's the case, when we're training or rehabbing these muscles, there's going to be some discomfort. It's just a matter of how much you can tolerate. You don't really want to do the exercise so much where you flare it up, but you want to do it enough where there is some discomfort at the source of pain, because when you load the tendon, there's going to be some discomfort, but that's how we know we're doing it properly. Give these a try and let me know how they go. If you have any questions, just leave them in the comment section below, and I'll see you guys in the next video. Thanks for watching.